time when we are reviewing, where are we here? Right now, yesterday we were doing recruitment of Kangata Care. We recruited 20,000 people. That means now we have covered now three tranches of coverage. Now we have 60,000 households in Kangata Care. That's progress. We haven't done 100%. But having 20,000 in the first term, 20,000 in the second term, and 20,000 in the third phase, we are somewhere. The second promise we made about school feeding program. Did we give our people uji? 42,000 children of ECD, are they drinking uji on a daily basis? The third promise, it's written in that plaque. It was about the community project, what we call the Ward Fund. To what percentage have we done? We began with 10% of our development budget. Right now we are at 35% of our development budget, which means how many ECDs have we constructed? How many health centers and dispensaries have we constructed? So far, we keep keeping track. Right now, we are at 350 ECD centers, and we are up to 24 health centers and dispensaries. The third promise, what did we promise? We promised about agriculture, about minimum guaranteed returns. What value chains have we brought in to guarantee that? Okay. We have milk, we have mango, we have a sorghum, and now we are going to avocado. When we do that, and I was talking about that plaque that is in my office about the promise we did make to the people of Murang'a. It's not that when that comment was made by that gentleman from Keno, that they are looking towards the unique leadership we are providing in Murang'a. We are not doing anything unique or anything that is super genius from everybody else. All we have done is remind ourselves that we made very specific promises to these people. To what degree have we done this? Because remember, when you look at SHA, and let's use because it's the headline today, and I want to see this. I want to praise, first of all, the president for his vision in terms of what SHA is supposed to be doing about the universal health coverage. Because remember, there are millions of Kenyans every day who go bankrupt in this country because they cannot access health care. Right now, go to every village in this country. People are doing harambes for the purpose of taking people to hospitals, for the purpose of a disease. Not only even the person who is at the bottom of the economic food chain, but even people who are well off, because the health bills are too high. And the insurance that we do have are not covering a majority of those bills. So when you talk about universal health coverage when it comes to SHA, or what is being called Taifa Care as we speak, it has rebranded to Taifa Care. When you look at all these things, then it's a very good vision for the people of this country. And the challenge that I am challenging the people who are implementing this, because when the president gives a policy, he has done his bit. He has pushed through this parliament, and now it's a regulation and a law. What is remaining right now is the implementation of this policy so that we can have equal access to healthcare across the country. And this is the challenge that we are having. How do we implement this? Because you cannot tell me that we are looking towards the people, and the number one thing that is supposed to take care of the people is the registration of these people at the grassroots level. Because remember, the primary care network is taken care of by dispensaries and health centers. And also, the people who we are calling the community health promoters at the grassroots level, who are supposed to lead towards registration of these people. The financing that is supposed to get to the health centers and the dispensaries is about capitation. And that capitation is based upon the people who register in that health center. If the government has no adequate financing to ensure that people are registered at the dispensaries and health center levels, when is that dispensary going to receive its finances if it has no people who have registered them? When is that health center going to get certain equipment so that it can function properly? How does that health center get the drugs so that it can dispense to the people? And these are the questions that are legitimate. They are not questions of politicization. They are not questions about these. What are the terms of registration that we have done? That's why when it comes to my specific implementation as a devolved function, when it comes to that, we have, in Murang'a, we have taken key steps to ensure registration, to ensure that people are registered in their healthcare, primary care networks. And so far, we have over 200,000 who we have registered under Kangata Care and even other means so that they can get to that healthcare within the various areas. Go to the next level, which is now the chief, which is at the level 4 and the level 5. The Social Health Insurance Fund. The Social Health Insurance Fund now takes care of certain diseases. Go to the next level, which is Emergency Care and Chronic Illnesses Fund. When you talk about all those things, their implementation and the information that is supposed to get to the people is supposed to be very clear. So that we have a step-by-step, know where we are, what we are supposed to be doing, and the right agencies are engaged. If you leave the counties out of the decision-making, and they are the implementers and providers of these healthcare services at this level, I'm telling you, then we are in for a rude shock that the system is failing.
Charles Amanga saying, watching from Kitale, Tanzania. Thank you, Charles. Boyd Barsite saying, I believe President Ruto is trying his best under an extremely difficult fiscal environment. However, he must ditch the public rallies and sit down and work. He should leave those to CSs and PSs. Do you agree?
Trying very hard as he can, that one don't agree, but also the advice is right. You see, I've been telling the president that the way you run government as a governance expert, and let me just highlight my experience here.